Good day, everyone. My name is Dr. Wang. Today, I would like to deliver a lecture on pathogenesis of viral infection. In this lecture, we will learn the definition of viral pathogenesis and principle of viral diseases. The main bulk of the lecture is focusing on the steps in viral pathogenesis. There are 7 steps in total. Then, we will touch on the 3 general categories of viral infections, which are localized, systemic, and persistent. We will discuss on the features of each category. Lastly, we will do a brief overview of viral pathogenesis in different body systems, such as gastrointestinal tract infection, respiratory tract infection, central nervous system infection, skin infection, and congenital infection. Here are some terms and their definition that is useful throughout this lecture. Infection is the invasion of the body by harmful microorganisms such as bacteria, viruses, parasites, and fungus. Viral pathogenesis is a process that occurs when a virus infects a cell and causes cellular damage. Disease pathogenesis is a subset of events during an infection that results in disease manifestation in the host. Host cellular response can range from no apparent effect of virus to the host cellular or cause cytopathology inclusive of cell death, cell hyperplasia, cell transformation to malignancy, which can lead to cancer. Viral disease means harmful abnormality that results from viral infection of the host organism. Lastly, clinical disease means the signs and symptoms that can be observed or elicited in the patient or host. There are few principles of viral disease. First, many of the viral infections are subclinical, meaning they do not cause any apparent symptoms, i.e., they are asymptomatic. They look well, healthy. In fact, most viral infections do not result in the production of disease. Majority of the viral infections are self-limiting. Self-limiting means the disease can recover by itself without any dedicated or specific treatment or management. Same disease may be produced by a variety of viruses. For example, common cold usually manifests by running nose, nose block. It can be caused by a variety of viruses, for example, rhinovirus, coronavirus, which are the 2 common viruses that cause common cold. Same virus may produce a variety of disease. Adenovirus can cause common cold. The same virus can also cause gastrointestinal, urinary tract infection, meningitis, and encephalitis. The disease produced bears no relationship to viral morphology, meaning by just looking at the disease or symptoms, we can't really tell what is the causative organism or its morphology. Lastly, outcome is determined by viral and host factors and influenced by genetic of each. For example, if you look at the current pandemic caused by SARS-CoV-2 virus, majority of the patients have mild symptoms. Some are asymptomatic, but there are a proportion of patients that have severe disease and some succumb to disease. So, the factors that determine the outcome are varies. Mostly are determined by the host factors, whether they are young, healthy, or having any underlying disease. In virus infection, the first step would be the exposure of virus to the host. Once we are exposed to the virus, there will be some sort of interaction between the virus and the host cells. And the effect of the virus to the host cells varies. It can be lethal or cytocidal, which means the virus actually causes cell lysis or cell death. It can also cause apoptosis. Examples of viruses that can cause this are poliovirus, adenovirus. Virus can also cause malignant transformation of the normal cells. For example, hepatitis B virus. It can cause normal cells to be transformed to malignant cells. For those patients who has hepatitis B, they have increased risk of hepatocarcinoma. The effect of virus to the host cell can be non-lethal. For example, hepatitis B virus, herpes virus, they stay with the host cell and cause persistent or chronic infection. As a result of the virus-host cell interaction, there are a few results that can come out from it. First, it can give rise to apparent or symptomatic, or what we call as clinical disease, or effects are not there or very subtle. It do not cause any symptoms that appear as subclinical. For some viruses, they remain in the host, but do not cause much damage to the host cell. Instead, they persist and live together with the host cells and cause chronic infection, latent infection, or slow infections. This diagram illustrates the classic iceberg concept of infection, dividing the seen or discernible effects of a disease process from the effects that are unseen. The disease process begins at a point of inoculation, reaching the prodromal or earliest onset of symptoms, and eventually becoming a full-blown observable clinical disease, where it reached the tips of the iceberg. Those patients that are visibly infected with an organism represent just the tip of the iceberg of patients that are colonized or infected. Just because a patient is not showing any sign of infection, it does not mean that he does not carry organisms that could be transferred to another patient if proper hygiene and other infection control precautions are not taken. The next concept we want to talk about is the incubation period. Incubation period is the time from exposure to the virus until the onset of disease. Remember the previous diagram, iceberg concept of infection? If the virus managed to gain entry to the host cell, this is where the virus will start to replicate, and host cell will begin to respond. During the incubation period, the patient are asymptomatic. This is at the early stage of infection. The incubation period varies between viruses. Some viruses, the incubation period is as short as in days. For example, influenza. The incubation period is around 3 to 7 days. Some are as long as in years, such as HIV. Alright, let's try out the quiz. Regarding virus, it does not respond to antibiotics. True or false? This is true. Why don't antibiotics work on viruses? Because viruses are different to bacteria. They have a different structure and a different way of surviving. Viruses don't have cell walls that can be attacked by antibiotics. B. It has a cell wall. False. Viruses don't have cell wall. Instead, they are surrounded by a protective protein coat. C. it is able to reproduce by itself. False. Viruses require a host in order to replicate. D. Is visible under a light microscope. False. Viruses particles are too small to be visualized using a standard visible light microscope. The equipment that or device that can be used to visualize viruses are such as electron microscope. E. SARS-CoV-2 is an example. Of course, you should know this answer. It is true. Next, we go to the main bulk of the lecture. What are the steps in viral pathogenesis? Remember, viral pathogenesis is a process that occurs in the host body once they are infected with the virus. There are 7 steps in viral pathogenesis. Viral entry into the host, primary viral replication, viral spread, cell and tissue tropism, cellular injury and clinical illness, recovery, and virus shedding. After exposure of host to virus, first step for the virus to cause disease is attached to the host and enter host body surfaces. The common routes for the virus to enter our body is through mucosa of respiratory or mucosa of gastrointestinal tract. Once the virus gain entry through the common route, they replicate at the point of entry. And the sites or location for the virus to replicate is usually where the disease will be manifested. For example, adenovirus gain entry through mucosa of respiratory, where it replicates at the point of entry. It will produce disease at the point of entry. What I mean is the symptoms of common cold, for example, running nose and nose block. Once virus attach and gain entry to the host cell, the virus will replicate. This diagram showing the basic steps in viral replication. First, virus attaches to the host cell, and virus will penetrate the cell membrane, inject the nuclei or genetic material to the host cells, and then hijack the host using the host machinery or resources. Virus will replicate. New viruses or virions will reproduce and release from the infected host cell. This table is to show you there are a few routes of entry for viruses. Like I said before, respiratory tract and gastrointestinal tract are the most common route of entry for most of the viruses. They are also point of entry via skin, through mouth trauma, injection, or bites. Once virus gain entry at the point of entry, some of the viruses replicate and cause disease at the point of entry. Some viruses travel throughout the body. The main way for viruses doing this is via bloodstream and lymphatic. This is where virus can produce disease at a distant location from the point of entry. Example given here is enterovirus, which gain entry through gastrointestinal tract, but produce disease at a distant location, i.e. the central nervous system. During the spread, the viruses may be free in plasma or may be associated with certain cell type, meaning viruses are being carried in a certain cell type. This table illustrates few viruses with their commonly associated cell type. For example, mumps and measles. They are commonly associated with lymphocytes. They are usually carried by lymphocytes through the lymphatic system, This is how they are being spread throughout the body. Their destination is at the skin, where the virus produces disease at the skin. This diagram showing the spread of virus from a point of inoculation to various organs and tissues. Once the virus is being spread via blood or lymphatic, certain viruses have the tendency to go to specific organ or specific cells. This is called tropism. For example, hepatitis B virus has tropism for liver cells. The virus will cause hepatitis, which means inflammation of the liver. Why this is so? This is because this process is driven by the fact that hepatitis virus can identify or recognize the cell surface receptor on the liver hepatocytes. Tropism determines the pattern of systemic illness produced during a viral infection. Once virus reach its destination, virus attach to specific cell and cause disruption of the cells. Once the cell disrupted, they cause physiological alteration in the host. For example, by disrupting the hepatocytes, liver became inflamed. The host will start to have hepatitis signs and symptoms. For example, jaundice, which is the yellowing of the skin and sclera of the eye. Once a virus manages to cause physiological abnormalities in the host, and the host starts to manifest some symptoms, this is what we call this patient has the disease. Some cells able to regenerate and withstand damage better than the others. Cells in the host of patient generate symptoms such as fever, malaise are usually results from cytokine production. Cytokines are cellular components of the host immune response. When the host responds to virus by eliciting our immune system, this can give us some general symptoms that we can observe in the infection. Degree of illness varies between one person to another, vary between virus to another virus. Majority of the factors are unknown, and degree of illness is ranged from asymptomatic to symptomatic to severe illness. After infection, the fate of the host is either recover or succumb to the infection. Remember I mentioned about how our body responds to invasion by the virus is by eliciting our immune system. Innate and adaptive mechanisms are the two big immune responses in the host. Interferon, cytokines, and humoral and cell-mediated immunity are all the immune components in the host. They play an important role in determining whether a host can recover or succumb to the infection. The outcome of a disease pretty much relies on the host and the viral host factors. In acute infection, the recovery of a patient is depending on the clearance of virus and viral-specific antibody production. In some cases, the virus persists in our body and stays in the cell and cause long-term infection. The term viral persistence is something we will discuss a bit more in the next few slides. The last step in viral pathogenesis is shedding of infectious virus into the environment. This is a necessary step to maintain a viral infection in populations of hosts. Viral shedding means that the virus in our body being shed out from the host into the environment, and this is important for the virus survival because they want to maintain the infection in the population of hosts, so they need to get out from the host to the environment in order for them to infect another host. Usually, shedding of virus occurs at the site or location where they first gain entry. During this stage, when the virus is being shed from the host body, this is what we call the infectious stage. Not all infection has viral shedding. For example, rabies infection in the human host, virus is not shed from the human host, as human is the dead end host in rabies infection. Now, we go to the general categories of viral infection. Like I said during the earlier slides, there are three categories of viral infection. First is localized or disseminated infections. Second is generalized or systemic infections. Third is persistent viral infections. Under persistent infection, there are chronic, latent, or slow virus infections. So, we know there are three categories of viral infection. Now, we look at their respective features. For the first two categories, localized versus systemic features are outlined in this table. For localized or local infection, the common example would be the respiratory virus, where the site of pathology is at the portal of entry. Remember, some virus replicates at the point of entry, and they cause disease at where they replicate. Their incubation period are relatively short because they do not spread to cause disease, and they replicate at the point of entry. The viremia, which means the presence of virus in the bloodstream, is absent in the local infection. The duration of immunity is variable, may be short. Role of secretory antibody usually important. Usually IgA. IgA is the mucosal antibody. In respiratory infection, mucosal antibody is very important. Now, we go to the systemic infection. Examples are measles, HIV, and hepatitis B virus. Site of pathology is distant sites. I think we have mentioned this before. For example, measles, the point of entry is at the respiratory tract. However, they travel and produce the disease at distant location. In measles case is at the skin. The incubation period is relatively longer than local infections. Viremia, of course, present because they do spread. From the point of entry, they spread and cause disease at distant location. Duration of immunity is usually lifelong. The secretory antibody usually are not important. In most viral infection, the virus does not remain in the body for a significant period after clinical recovery. However, in certain instances, the virus persists for a long period, either intact or in the form of genetic material. In persistent infection, the cells are harboring or carrying the virus, hence the cells are not lysed immediately. In persistent infection, the virus either remain latent in the cytoplasm or its genetic materials are incorporated in the host nucleus. Under persistent viral infections, there are chronic, latent, and slow virus infections. We will first look at the chronic infections. For chronic infection, the virus are replicating continuously, often at low level. Usually because of the low level, they do not cause much signs or symptoms or apparent effects. During this chronic infection, RNA viruses, for example, HIV, they undergoes many genetic and antigenic changes. This is important to understand because this is one of the reasons vaccines for HIV are difficult to manufacture until today. Meanwhile, for latent infection, the virus, for example, herpes simplex virus, it can actually persist in the host in a hidden or cryptic form. They are hiding in the host cell. Because of this, our immune system does not really recognize them because it is being hidden. Herpes virus, they actually stay latent at the sensory ganglia. At this stage, where they are staying latent, they are not infectious. But this virus can have what we call the intermittent flare-up, where if the host under immunosuppressive stage, which can be caused by stress, immunosuppressive drug, UV light, this latent infection can cause intermittent flare-up. While they are latent, they cause no problem. But if the host is in immunosuppressive state, the virus can cause flare-up of clinical disease. Virus can be recovered during a flare-up, but not during the latent infection. This diagram is to show you an example of latent infection. Example given here is herpes simplex 1 virus. At the primary infection, the patient has mild pharyngitis or stomatitis. The virus travels up to neuron in dorsal root ganglion where they will remain latent. They will not cause any problem, but once the host is in immunosuppressive state, which is caused by fever, sunlight, menstruation, the virus can travel back where they can descend and cause disease. In this case, they can cause cold sore. Second example is variola zoster virus. First infection is chickenpox. Virus will travel up and stay latent in the neuron in dorsal root ganglion. If the patient is in immunosuppressive stage, the virus will descend through the neural pathway and cause zoster, or what we call shingles. These photos are just to show you how stomatitis, cold sore, chickenpox, shingles look like. The last infection under persistent infection is slow virus infections. The term slow refers to the prolonged period between the initial infection and the onset of disease, which is usually measured in years. What we mean by this prolonged incubation period in years is the viral growth is slow. Two examples of slow viral infections are SSPE and PML. SSPE stands for subacute sclerosing panencephalitis. The causative agent is measles virus, and the incubation period is around 2 to 20 years. PML stands for progressive multifocal leukoencephalitis. The causative agent is JC virus, and the incubation period is up to years. And it can cause central nervous system demyelination. We have completed with general categories of infections. We have also discussed on localized, systemic, and persistent infection. Now, we will do a short overview of pathogenesis in each of the body system. For respiratory tract infection, the virus gain access to the human body via the respiratory tract or via the aerosol droplets or saliva. This is the most common methods of viral entry into the host. Most of the infection in this category remains localized in the respiratory tract. Disease symptoms exhibited by the host depend on whether the infection is concentrated in the upper or lower respiratory tract. Again, where is the burden of the virus is where the disease is being produced. If the burden of the virus or if the virus mainly replicates on the upper respiratory tract, you have symptoms such as running nose or nose block. If the virus is replicating or if the burden are on the lower respiratory tract, you have pneumonia. The disease is determined by the locality of the virus. Next, gastrointestinal tract infection. Many viruses initiate infection via the gastrointestinal tract. Viruses are exposed in the intestinal tract to secretory IgA and harsh elements involved in the digestion of food, for example, acid, bile salts, and proteolytic enzymes. Consequently, viruses able to initiate infection by these routes are resistant to acid and bile salts. Most viruses can cause either local or systemic infection. For example, rotavirus, calicivirus are common cause of gastroenteritis. Poliovirus and hepatitis A virus are important cause of systemic disease but do not produce intestinal symptoms. When the virus causes infection or inflammation of GIT, usually patient will present with either watery diarrhea, fever, vomiting, or systemic manifestation. So, the collection of symptoms is what we call acute gastroenteritis. For infection of the skin, viruses can either obtain entry through small abrasion of the skin or introduced by the bite of arthropod, vector or infected vertebrate host, or injected during blood transfusion or other manipulation involving contaminated needles. These are the three main ways of virus that can obtain entry to cause infection of the skin. Once virus gain entry through the skin, few of them remain localized and produce local infection, mostly spread to other sites. Some other viruses, they actually come from another route of entry. They reach the skin via hematogenous way or via the bloodstream, and they form rash at the skin, for example, measles infection. Here are some pictures of vesicular rash and maculopapular rash. In vesicular rash, you can actually see the sac-filled fluid. In maculopapular rash, it looks like red bumps on the flat red patch of skin. In maculopapular rash, the infectious virus is not shed. In contrast to vesicular rash, the infectious virus are present in high titer and they are able to spread via direct contact. Next, infection of central nervous system. So, how does a virus reach our central nervous systems? There are two ways, either via the bloodstream or peripheral nerve fibers. If they travel via bloodstream, once blood-brain barrier is breached, they can cause extensive infection of brain and spinal cord. And for those that travel via peripheral nerve fibers, the virus actually are being picked up at the sensory nerve or motor endings, and they move along with the axon, and they reach CNS via this way. And these routes of spread are not mutually exclusive, meaning a virus may use more than one method to gain access. Many viruses, including herpes, can infect CNS and cause meningitis, encephalitis, or both. Meningitis is the inflammation of the meninges, whereas encephalitis is the inflammation of the brain parenchyma. This slide just to illustrate to you the barrier that serves as our defenses against microorganisms. This diagram shows the normal blood vessel and brain blood vessels. The blood vessels in the body are slightly porous, allowing nutrients to flow freely from the blood to the surrounding tissues, whereas brain blood vessels have no pore, and the exchange of substance between the brain and blood vessel is actively regulated by carrier proteins. This diagram is to illustrate to you how the virus travels via peripheral nerve up to CNS. The virus actually are being picked up at the sensory nerve or motor endings, and they move along within the axons and they reach CNS via this way. This is to show you where is the meninges and encephalitis. Meningitis is the inflammation of the meninges, which is the covering of the brain. It comprises dura mater, aracoid mater, and pia mater. Encephalitis is the inflammation of the brain parenchyma. Meningitis and encephalitis are the two main kinds of neurological conditions related to the brain and spinal cord, where the layers surrounding the brain or the brain itself gets inflamed. Lastly, we'll talk about the congenital infection, which means infection to the fetus in utero or to the newborn. Most maternal viral infections do not result in viremia and do not involve fetal. However, if the virus crosses the placenta, serious damage can be done to the fetus, and it can cause fetal death, premature birth, intrauterine growth retardation, or persistent postnatal infection. The common viruses that can cause congenital infection in humans are rubella virus and CMV, cytomegalovirus. The second part of congenital infection is infection to the newborn. For those infections of the newborn, viruses can actually come from the mother during delivery, or the infection may be acquired during the first few weeks after birth or postnatal from maternal sources, family members, or caretaker via family members or hospital personnel, or through blood transfusion. For example, infection that can be transmitted to a newborn is HIV, which can be transmitted via breast milk of an infected mother. Remember, congenital infection is either infection to the fetus, which occur in utero, or to the newborn, which can be acquired during delivery or during the first few weeks of after birth. This slide is to show you the virus infection of the fetus. Virus infect susceptible pregnant women, then cause maternal infection, and the virus can travel or can infect the fetus via vagina, or they can cross placenta and reach the fetus. Viruses that cross using these ways can cause fetal infection or in utero and can cause diseases. In summary, we have discussed the definition of viral pathogenesis and principle of viral diseases. We also talked about the steps in viral pathogenesis, and we discussed the general categories of viral infection, which are localized, systemic, and also persistent infection. We also did a short overview of infection of different systems. Please attempt the quiz after you have finished reading the slides. If you have any questions, you can contact me via email or WhatsApp. These are the references that I use in this lecture. I would also like to acknowledge Dr. Noazia Shalan, as most of the lecture content are prepared by her. Thank you.